To welcome our next guest, Hesham. He's going to be talking about Hexitime, and I've got another quote for you from the positive quotation book. So, not everything that can be counted counts, and not everything that counts can be counted. Thank you. Over to you, Hesham.
Thank you, Vanda. Hi, everyone. Good afternoon. So, as Vanda says, my name's Hesham Abdalla. I'm a consultant paediatrician, and I'm the quality improvement lead at Oxford University Hospitals. And I'm presenting to you today an initiative and an improvement platform called Hexitime, the slogan of which, as you'll understand in a moment, is "Give an hour, get one back." And I co-founded the platform. It's the world's first professional time bank supporting systems to improve health and care. It's a website, so it's on hexitime.com, but we're also on Twitter at Hexitime, and you can email us on that email address. So that's what I'll be talking to you about over the next kind of 45 minutes, and then we'll have 15 minutes for Q&A, but I'm going to try and make it a little bit interactive as well, so there'll be opportunities for you to kind of interact with the platform as well as the idea. And the format that we'll be going through is essentially why there was a need for it. Why did I and my co-founder set it up? Who we are, what's the background, how this time banking idea works. You may or may not have come across it before. Importantly, the difference it makes, what impact that has had, and then finally, how you could individually, collectively benefit and contribute to that platform. So that's essentially what we'll be talking about. So my story starts probably about 5 or 6 years ago. So I was newly appointed as a clinical lead for my paediatric department. So this really should have been the pinnacle of my career. It's a job a profession that I'd wanted to do since I was being a kid myself. I was leading this kind of new paediatric team in North Warwickshire in a recently reconfigured service with a real passion for improving quality of care for the population. So I think we're ahead of our time really when we're talking about population-based medicine. And we were doing great things. We're taking our organisation out of special measures. It was a big part of that, and it became even more meaningful really for me when my dad, who was kind of my role model really, and himself a doctor, passed away at the hands of substandard medical care. So we were doing amazing things, and I remember the day we came out of special measures, which, looking back on it, was actually probably the beginning of the end, because the chief exec at the time, made this little announcement, whoever can come to the canteen, come to the canteen. And it was a small hospital, so we could get most of the staff there. And he made this announcement saying, we're out of special measures. And there was real tears, actually, because we'd been a lot of work getting to where we were, and, the TDA kind of making that announcement. But what I didn't realize actually that there's no parachute payment. So when you come out of special measures, you don't get the resources that you had to get you into that place. So the chief exec left, I think, to take a job up in Cumbria. Medical director retired, nurse director went to Dubai, and the conversation all went from quality to finance. And really what I found myself doing is kind of trying to keep it all together, kind of working harder and harder, the thing that I've been doing ever since I was a kid, just assuming that was going to work, coming in early, leaving late, and not, and this is the important bit, doing what I probably could have done, which was empower my team to do the work. I was trying to kind of pull the strings and trying to make it work. And slowly but surely, I retrospectively now was obviously getting burnt out, and I was losing the faith of my senior leadership as well as my consultant team, and also faith in myself. And so I resigned not just my clinical lead role, but my job as a consultant, actually. So the job that I had been wanting and dreaming of doing, I left. And so for a while, I was, for the first time in my life, unemployed, and probably unemployable as well. And it was during that kind of time where I discovered this idea of time banking, actually, in a local time bank that I joined. And in Tracy, it's just, like I said, you give an hour and get one back. So for example, if your next door neighbour breaks their leg, you can spend an hour of your time mowing their lawn, and you don't get paid for it. You get one credit from that individual, and then you can use that credit to get someone else's help in that local time bank. Say, for example, if you wanted some help filling in your tax return, and there's an accountant there, they can do that, and you get that bit of help. And you'll notice that 3 things happen here. Firstly, stuff gets done without having to pay for it. There's no financial transaction. Secondly, it connects people up in that neighborhood in ways that they probably wouldn't have done otherwise. It's a kind of community building idea. And the third thing, which is a bit more subtle, but I think probably the most important, which is that it's an asset-based model. So it's based on what you can do rather than what you can't. So you might be unemployed and you might not think much of yourself, but you can mow a lawn. And that's really important. I thought all this stuff happening, and I'm thinking about the similarities with healthcare, because we're also working in silos. We're also trying to do more with less, and we're also focusing on our deficits rather than our assets. So I thought this kind of idea of time banking could work for healthcare improvement, and I kind of pitched the idea to the Health Foundation in 2018 to something called the Q Community, which I encourage you all to become a part of. And at that Q Exchange in 2018, we were the most, it's quite an unusual funding bid because you get voted on by the other individuals within the community. So it's quite an empowering way of doing that, really, because you kind of almost got a constituency. But it also comes with a bit of responsibility, because if they vote for it, you get the money, you need to do it for them. So that was where we kind of started off this time bank idea. And we built it from two people. So it's John and I, the two co-founders. John's an NHS manager who we kind of worked on this together. And we developed a prototype, and it went from 2 to 220 to 200 to 2,000 members of this community, which I'll be sharing with you in a moment, of individuals across the NHS, and then it became across health and care, and then it came across the whole of the UK, and now it's international. 13%, I think, of our hits last time I looked were from outside the UK. And these individuals, as you'll see in a moment, are all sharing skills, sharing experiences, banking their time. So this kind of virtuous circle, and it's been really beautiful actually seeing this grow. And as you'll see in a moment, it's an all-inclusive platform. So anyone who wants to be involved can be involved, and I'll show you exactly what kind of things we've been doing. So in summary, it's a healthcare time bank and skill exchange for improving services. And it's a community of NHS, but like I said, health and care staff who are working smarter and kinder, not harder. I think that's particularly important in our kind of post-COVID times. We've won lots of awards, as you'll see in a moment. And importantly, and you'll see this is probably one of the key underlying principles, is because everyone's time is valued equally on the platform, it's a really effective way of reducing health inequalities, because it builds on what people can do. It's currently set up as a not-for-profit community interest company, so we were looking at sustainability of this platform right from the start. So once that Q Community grant kind of extinguished, really, we've been getting funding from other organisations and networks, and you'll see in a moment how they have contributed to it. So that's by kind of way of introduction. In terms of the awards that we've won, we've been shortlisted for a number of HSJ awards, including not-for-profit working in the NHS, but we've also won HSJ awards, the IT and Digital Innovation Award, the Best Sustainable, the Best Sustainable Business. That was one of the other awards we won, and you know, it feels like a bit of a diva, but I think we've won 6 or 7 national awards this year, which is amazing. And we've also had European Innovation Awards. So we've just 20 minutes ago just won a contract in Latvia across the Children's Hospital in Latvia that are looking to use this kind of time banking idea to help improve healthcare across their chain of hospitals. So it's an idea which started just from, you know, from kind of a really low point of mine actually, but in many ways it's allowed things to happen that wouldn't have happened, and it's kind of growing even beyond what I could have dreamt of. And the membership is something I'd like to show you now. So this is the website, so hexitime.com, and if you were to click on the members page, which is, you'll see that this first thing I do every morning is check what the membership number is. So you've got 2,086 members on there. These are the most recently joined people, so you can just see in reverse order. So you've got researchers, an American doctor, a clinician, scientists. You can also be joined as an organisation, and I'll mention why that's important in a moment. ACPs, AHSN, mental health lead, QI leads, students. So, you know, and actually we also have kind of patients and service users who are joining this as well. But all you need really is an email address. So those are the most recent ones, because when you first register you put in what your interests and your profile is. You can also search by best match, and that, just like it does on Facebook, brings all the people who are most likely to pique your interest to the top of the screen. So you've got here individuals who may be people I might want to bank time with. So CCIO, transformation managers, assistant directors of improvement, a patient actually who's a quality improvement and patient safety lead. So that's just to give you an idea of who is in. And what's wonderful really is the diversity of people from the top and the bottom of the NHS, so head of NHSX, NHS Digital, NHS Improvement Scotland, all the way down to kind of the lowest tier of the of most organisations you'll be working with. And Amanda, you're in there as well, which is nice. So that's essentially where we've got to in terms of membership. Let me just see if this. But what we realized after a while is that it's great to kind of be growing it member by member like that, but actually that's only going to lead to kind of linear growth. And what we wanted to do is grow this bigger and quicker, because the vision that we had is that this could contribute to a world where it's as easy to give an hour of your time as it is to give a fiver for charity, where you in any role, senior or junior role within your healthcare system, you can be expected to do an hour on the bank, just as you would do in any role. So it becomes almost a part of a giving community, and that's really where we wanted to take it. So the three rules in Hexitime are quite straightforward. Activities are to improve health and care, no money changes hands, and 1 hour equals 1 credit. And we're leveraging this now to help increase inclusivity, particularly amongst researchers. So we've been doing all this work in QI, but it occurred to us that the need amongst the research community is as much, or perhaps even more so. Very oftentimes you'll have bits of research working in different organizations, but there often isn't much collaboration between them. And the other problem that I faced in speaking to some of my research colleagues was the kind of snowy white peaks of the NHS. So the higher up you go within the NHS, the kind of the whiter and the maler it becomes. So, and that's particularly so in research. If you cheekily were to do a Google search for professors in your local university hospital, what you'll find at the top of the first page, or most of the first page, will be white male medics actually, and that isn't good for the industry, but also isn't good for healthcare outcomes, because what will often happen is those questions that are being asked by those researchers are questions that may be of interest to them, but don't necessarily represent the demographics or the people that, or the study of the individuals that we want to be studying. And we therefore set up a campaign, and Amanda, you're a contributor to this as well, looking at how do we increase diversity amongst researchers, and particularly ethnic diversity. And this little video promo gives you a bit of an idea as to what that can mean. I'm not sure if my audio will be shared. Let me see if I might need to stop and then share again. As I was saying, we're increasing the membership, and it's been growing person by person, but we thought actually what may be better and quicker is if we were to expand it network by network. So rather than linear growth, we can be talking about exponential growth, and therefore we were approached, to be fair, first by the NHSR community. The NHSR community, are, again, if any of you are aware of it, R is a programming language, and there is a national group of programmers who use the R programming language, and they were a community essentially looking for a platform, and we were a platform looking for communities. So there was a natural match on that score, really. And so we launched, we onboarded their community, kind of a few thousand individuals at one of their national conferences. And we asked them, as I'll be asking you in a few minutes, what is it that you need to help, achieve your organizational or individual aims? And they came up with a list of stuff. This was a facilitated workshop online, actually, on Miro. And then we asked them the same question, but this time, what is it that you can offer? What kind of knowledge, what skills, what kind of resources do you have that you could offer people? And then they had these two lists. And then we said, actually, there's a lot of things on list one that correlate with list two. So why don't you just put it on Hexitime, put it on an offer or request based on the kind of things you're saying, knowing that there are people in this same room who could potentially help you with that. And this is the consequence of that particular workshop. So this is a little bit small, so I'm going to show you the bigger screen And what you can see there, I think, Vanda, can you still make out that map, the network map? Okay. Let me see if I can share that screen again.
Vanda seems to be spotlighted instead.
Okay, let me try that one more time. Yeah, have we got it now, the Miro board? It's got a little red line around it. Okay, perfect. So
Yes.
what you can see here is the network of exchanges that had happened by a few weeks after that NHSR community event. And every one of these individuals is an NHSR community member on Hexitime. And every one of these blue lines that you can see is an hour exchanged, so a time banking exchange. So what you might notice straight away is that there are some individuals here who are super spreaders, really. So for example, if you look at Chris here, mainly, he's got an offer on the platform for mentoring statistics and data. And clearly this is a group of geeks who are interested in statistics and data. So there's a lot of individuals who've taken up that offer, and you can see all those hours that are being exchanged. But what's interesting is what happens from there. So you can see, for example, Thomas Knight is a doctor, but also a coder. He's offered and received help from Chris, but he's also helped a researcher, Barman there, who's looking to participate in modeling collaborative, which I don't know what that is, but that's why they exchanged on. And then the kind of credits move on. So he'd had another exchange with Chris Bealey, who's a data scientist. But what you notice now is there's these kind of red lines that occur. So red lines are credits exchanged, or hours exchanged between NHSR community members and other members on the Hexitime network who aren't members of the NHSR community. So here, for example, Chris, as well as the data scientist, obviously conducting some research, and he's got some literature review support from another Hexitimer, Dr. Suzanne Nunn, who's helped him along that. So the kind of the credits are moving along now from one community into another community. So they're bringing kind of, essentially we've got a network of networks happening, and you can see how this all kind of feeds together. And I just want to focus for a moment on this character here. So Daniela is kind of using Hexitime as it should be used, really. So she is earning lots of credits through a couple of her through one of her offers. So she's got this offer here where she reviews your LinkedIn profile to have more impact, and she had this offer particularly for people from Black and minority ethnic backgrounds. And what she asks is, do you think that social media presence will be the one that gets you a job? You know, will anyone tap on your shoulder having seen you on your LinkedIn? And the reason I know about this is because I took up her offer, by the way. So that was one of the things. So she's offered this really good kind of coaching review, really, of your social media profile. And all these individuals have taken it up. And she's also, she's Colombian. So she's also picked up on a request that we had from Hexitime to translate it. So she's translated Hexitime into Spanish for us, some of kind of the background work. So she's earned a whole bunch more credits through that translation. And then she's used those credits to help her career development, actually. So she's got some career coaching, she's got some CV review and interview coaching, advice on academic writing, executive shadowing from Suzanne, coaching and CV review, and executive board shadowing. So she's got all of that stuff pro bono, essentially. And what recently happened is that she was appointed as chief exec of a chain of GP surgeries in northwest London. So, you know, which is great. And you know, I don't know if she would have got the job without having done all of this, but she tells me that this all helped her. So it's just a nice example of how, you know, people helping people essentially has led to connections and exchanges that wouldn't have happened based on the assets of the individuals in the room. And oftentimes these are unexpected things. So whether it's just translating into Spanish, or more recently, one of the loveliest offers I saw on Hexitime was from Olivia, who's a student nurse, who you could walk past in the corridor several times and maybe not even notice her. But what Olivia is well, her super skill really is she's a poet, and she writes amazing poetry. So the offer, if you wanted to take it up on Hexitime, is to run a poetry workshop for your staff, and she'll do that. And I think a lot of us need poetry, actually, and in many ways that is the kind of unexpected things that have been coming up here. So even though I set up this platform, I'm continually surprised and amazed at the kind of delightful things that staff can do and are exchanging. So it's kind of scrolling a little bit more. The other thing I mentioned, and it was, I think I saw Carol on the platform actually. I think she joined a little while ago. But you can also, because it doesn't matter what your band is or what your grade in is, or you know, what you might have noticed on that Miro board is what it doesn't say anywhere is what location you are. It doesn't matter which organization you're in, because that's irrelevant. What you really are interested in is what skills and experiences there are. So that also includes patients or experts by experience. So if they have an offer they can make, whether it's to share their own experience or they actually have lots of other skills, they might be accountants or barristers or whatever it happens to be, then that can also be something that could be useful for an individual within the healthcare setting. So those offers are also really valuable. And sometimes people ask me what benefit would a patient have from gaining a credit, and this comes back to something I mentioned earlier on, which you can join as an organization. So if a patient gain a couple of credits, they could potentially, if their GP surgery is on Hexitime, donate those credits to their surgery, and that surgery can then pick up on some of the professional or improvement skills or the research skills that could help those individuals within their surgery. And I'm going to stop in a few minutes, but I just wanted to share this network story, because this is one that's kind of really quite close to my heart, and is actually, there's a bit of a kind of a culmination that happened just yesterday or last week on Twitter that you may have seen. The Shuri Network are a national network who are proponents of women in colour in digital tech health. So digital tech tends to be, again, like many things in our industry, mainly kind of white male. And in fact, I was teaching at a conference, or presenting at a conference in a medtech conference in Malta last week, and the only woman of colour in the whole conference was serving tea and coffee. So it's very much an exclusive domain. And so the Shuri Network's mission, or their raison d'etre, really, is to increase diversity and to support particularly women of colour in this industry. So they came to us looking for some support on that platform, and what they launched is a shadowing campaign. And the way this works is that someone who is a senior leader in clinical informatics, say, chief clinical information officers, but also heads of, startup organisations, NHSX, NHS Digital, and there are dozens of those individuals, can offer 6 hours of shadowing for a Shuri Network member on the platform. And that was the kind of the design of their campaign. And actually anyone here can potentially contribute to that. And this is what happened after their event. So they had a number of exchanges happening, and we've been monitoring that over the last kind of few weeks and months. And just last week, they won a HSJ award themselves. So we'd won a few, but what was really nice is this was a community that all we had done really is host them, that had allowed them to really maximize what they have achieved. And I don't know if you can see the quote there from the HSJ judges, but just reading it kind of make my heart sing. So the judges felt this was an incredibly strong submission and truly laudable project. The mission is commendable, and it's highly impressive to see the level of growth over the time that the project has been running. What really stood out to the judges about this project is that none of it can be considered business as usual. All of the work done was adding immense value in the health and care sector, an area where too little work had been done in the past. The panel were blown away by the achievements of the organisation and excited to see what comes next. So really kind of amazing, actually, what they've achieved. And what's probably even better for me is that I hadn't really got involved in much of this myself. There's lots of different leadership quotes, and I'm not sure if you mentioned this one, Vanda, but one of my favourite ones is the great leader is he or she who, when the work is done, the people say, we did this ourselves. And this is very much along those lines. It's like, well, we just gave them the sandpit. You do what you can, and this is the amazing thing that they have been doing. And this little Kumu map is essentially a representation of some of those Shuri Network campaign exchanges. So I can put the link in the chat, but what you can do is actually discover who's exchanged who is what with whom. The larger images of those that have done more exchanges. So it becomes essentially a network map of all the individuals who are there. So again, which organisation they're in is irrelevant, because we're taking money and line management off the table. So I'm just going to pause, because I've been talking for nearly kind of half an hour now, which I thought would be useful to think about individually or in groups, how you currently find allies to collaborate with? You know, when you're looking for help, how do you go for help? And the reason that's such an important question is particularly in a sector or an industry like ours, asking for help is a bit of a taboo, because not knowing is sometimes equated as not doing, or you know, error or failure equates with patient safety issues or patient risks, and that means harm. So there's in a way, there's a great phrase in that every system is perfectly designed to deliver the outcome it delivers. So we were in an industry where not knowing is actually frowned upon, and that in many ways propagates the silos that you and I are inhabiting. So I'm interested in knowing even how you ask for help and how you find collaborators or allies in the work that you're doing. And the second question is really, again, maybe this is kind of more of a selfish one, is because I've, you know, founded this platform, I'm kind of invested in it, you know, because this is a kind of little project which has become passion for me now. But I'm interested in knowing, what do you see as the strength, weakness and opportunities of this kind of time bank idea for improving health and care services? So I don't know, Vander, maybe if you, or Claire, if you had any thoughts on either of those questions.
It's interesting because I can hear myself.
No, you're okay from my point of view, Claire.
Oh no, I can hear myself.
Oh, yeah, okay.
Right. You hear me? You hear me? Yeah.
Yes,
I was writing some notes while you were talking, and when Vander first told me about Hexitime, I had some reservations in terms of a local approach to doing things for others, because that's what I suppose we should do for each other, and this idea of it being banked, I couldn't really wrap my head around. But actually listening to you talk, I think it's much more than that, and actually it's the wider scale, isn't it? It's been able to connect with people outside of your organisation and in different specialities or settings. For myself personally, talking about like where you currently find allies. When I was a student nurse, I was quite lucky to be involved with some work with NHS England, and they invested quite a lot of time in us. But one of the things that they really drilled into us, which I don't think other nurses or student nurses really got, was the importance of networking and understanding that people might be more senior than you, but actually they're just people. And I think I learned very early on in my career that people are people and you can go to people. So it gave me a really different perspective probably to my peers. So when I'm looking for allies, I would say I'm very good at networking. I put myself out there, I'll reach out for people and I maintain those relationships, which is helpful then when I need stuff doing, because it kind of comes back in full circle and I can support them and they can support me. And obviously as I grow through my career, I can offer more, you know, to other people. But then with the whole COVID situation, I think this is where Hexitime really now is quite fitting for its time, because actually we're not at conferences. I'm not out meeting people like I used to. I'm not having there's coffees with people that I would normally have coffees with. I'm not traveling around the country doing different things. It's all digital. So actually having having something like this is powerful, because actually it makes the world smaller in the sense of networking, which I think is with that connectivity is brilliant. Actually your infographic about what people were doing, it was very similar to a new platform that I'm using called Research Rabbit. So it's, I don't know if you've seen it, so it's connecting research. So you look at a paper and then it will give you a sprout off of all the different of how it's all connected, and that kind of visual imagery has led me. I'm doing a PhD, and what that's done is bounced me from one thing to the next, which you were talking about. So it's done that within research, to see that same kind of imagery and how that can happen in terms of connectivity. I think is really powerful. And Twitter I use quite a lot for connecting with people, but this feels a little, and it can be a horrible place sometimes, Twitter. We'll talk about it in the break. And I think what this does is almost it brings that professionalism into it. So it narrows it quietens down all the noise in the background and the, you know, whatever else is going on, and hones back into people with skills and being able to connect people with people. And yeah, I think I've been won over.
That's amazing, Claire. I'm so glad. It's always nice to hear some kind of what you think in your head being said by the people, because otherwise you think, oh, it's just my internal voice saying this kind of stuff. Picking up on a couple of things you said there, Claire. So one thing I'll show you in a little bit later is we've got something called badges, so that you're able to identify a badge. So for example, we've got badges for Q community members or different groups. So if you wanted to find other individuals who are in your same network, you can do that. You can search for it. So that's just so that you've got your kind of your group, but also part of that kind of wider group in the way that you've kind of described. And the other thing that really resonated with me was your point there about conferences, because oftentimes it's those kind of coffee table conversations where you really have genuine, you know, you can attend all the lectures and get nothing out of it, but it's that 10 minutes you've had over coffee that you've really learned something. And what I haven't shown you on that map, or that you've seen all those lines, is where the magic has really happened is on the conversation that happens with those individuals. You know, if it's a GP shadowing a pharmacist, or someone from Walsall shadowing someone from Wolverhampton, suddenly those kind of boundaries, probably imagined boundaries, suddenly dissolve, and ideas are catalyzed. You know, exchanges or kind of projects are envisaged, or pathways are imagined that wouldn't have happened had they been in their same silos. So it's both a transactional, but also probably, from my point of view, more important, the relational aspects of those exchanges, which really kind of are what the transformative aspect of it. And I think you touched on that. I'm interested in your thoughts, Vanda, just before I can move.
As you know, we've talked before, and really Claire articulated it very well, that I myself was quite dubious about what this can bring, because you know, isn't this how a good colleague, a good person, a good professional person should behave anyway? But we know in reality other things take precedent, and this kind of thing doesn't happen. So I think the platform there to make those introductions and it does what it says on the tin is very important. And also looking back how I was years ago, I wouldn't dream of approaching somebody. I wouldn't have the confidence to do that. So that comes with experience and time, really. And doesn't, you know, it's something that you acquire along the way. So I think it's such a good thing. And you giving that example of the lady sort of giving advice about and building her confidence and her connections, and research is about connections and relationships in everything that we do. So yeah, I think it's definitely got a place here. You said earlier that it has no sort of financial incentive. So how do you sort of hope to sustain when the Health Foundation funding sort of dries up a little?
So I'll come back to the financial thing,
because that is a real problem within the NHS.
Sure.
We are quite cash poor with regard to promoting initiatives.
I'll mention the financial stuff, that's important as well, but just want to pick up a couple of the points that you and Claire have made, actually. One of them is around seniority, and how, you know, we're all kind of a bit more senior in our careers now, and what happens is with that seniority, you develop a kind of little black book of contacts, don't you? And then that in itself is a privilege, because you know who to go to and where to go to. But actually, in many ways, the advantage for this platform is, as you say, those people who are probably the most junior in their careers, who haven't had the advantage of experience in networks and seniority and so on. So I think that's something there about leveling the platform or flattening hierarchy that this does in a way that maybe something like LinkedIn or something else doesn't. And the other one, which I think is a really important question, Vanda, is around, isn't this what good professionals do anyway? And I think it is, actually. But oftentimes when you help someone, and this is human nature, it's not a criticism, there's a kind of an unwritten kind of expectation that you might help me back. So say, for example, I've covered for a colleague a night shift, for example. Next time I ask for a night shift to be covered, and if they don't cover me, I'd be like, well, you know, I helped you, you know what's going on. So there's that kind of idea of reciprocity is inbuilt in this, and in many ways that's what kind of builds those ivory towers, actually, because you've got little cliques who know each other and who've done those little bits of support. But what this does, by adding in this credit, this kind of funny money, is allows you to pay that debt forward. So say, for example, Vanda, if I were to help you, I'm doing a master's in human factors at the moment, I could do a tutorial on human factors, for example, I think I mentioned. But I don't necessarily need you to help me back. I could say, well, you know, Vanda, could you just help Claire out with something that she needs? So it suddenly allows, you know, that debt, so to speak, that credit to be paid on to someone else. So it allows, and that I think is slightly different and wouldn't be enabled just by that kind of professional kind of reciprocal support that would otherwise be worth. So I think that's just something I just want to pick up on, because I've been wondering about that as well. You see, I've had that same question put to me a few times. In terms of answering the kind of financial question, because that's an important one as well, is because I'm obviously a QI lead. You know, sustainability has been part of my thinking right back from the start. So John and I, we've been thinking about that right from the beginning. So we've always wanted Hexitime to be, you know, free at the point of care, you know, true NHS principles. So you, me, anyone can join this. You know, all you need is an email address, and you need to fulfill those 3 criteria: that you're not going to exchange money, that every time is valued equally, and 1 hour equals 1 credit, and you actually have to be over 18 as well. That's just the other thing that you need to be able to sign off. But other than that, it's free. So where do we come to funding? So we thought the funding comes from networks, organizations that want to drive collaboration within their system. And whether it's the Shuri network, the NHSR community, or other healthcare systems, we've got 3 academic health and science networks, for example, and perhaps in the future, maybe ICSs could be the funders for this kind of approach as integrated care systems. Also, I'm hoping we'll have some workforce plans that they're developing, because it's not just about governance structures, it's about how do we get individuals working across an ICS. So I'm looking to see maybe whether I've got a conversation with one of the ICS leads this week to kind of discuss that. So that's where the kind of funding comes on from an NHS point of view. We're also looking at kind of white labeling it to other countries. So as I just mentioned, a hospital chain in Latvia just agreed to that just this morning. We've had good conversations in Malta when I was there last week about maybe developing something for their own healthcare system. So there's something there around other countries, other healthcare systems, helping subsidize ours in a way, but also maybe even other industries. Randomly, I had a link from Screwfix for organizations, would you believe that, saying, all right, we've come across this idea, you know, could we use it for our internal communications or internal you know, facilitation? So, well, if you pay for it, then we could do that. So I think there's something there about how maybe for us, perhaps in the NHS, this can be a bit of a, you know, this funding needs to happen to sustain it, but actually maybe it's the other industries that can help kind of subsidize it further on. So that's where our thinking is at the moment in terms of the kind of funding or the kind of business model, so to speak. But it will always remain a not-for-profit, and it's, as I said, it's set up at a CIC at the moment.
Are there any competitors out there as well, Hesham, who do a similar thing?
Yeah, so I guess you've got things like collaboration platform like Microsoft Teams. You know, we're on Teams at the moment, aren't we? We've got other platforms that allow social networks. I mean, you got Twitter or LinkedIn or film. So you've got those aspects to it. So there's but I don't think there's, and I've not come across anything which has the credit system, this time banking thing. There's time banks of place, but certainly this is the first time bank of purpose that has been created. So no, not yet. And I'd be interested in if anyone on the chat or anyone has come across one. But I've been through a lot of networks and a lot of organisations, and there's nothing that I found quite the same as what we're doing. Particularly one that's around kind of exchanging kind of professional skills or competences. So I guess the last thing is really in the last kind of few minutes is to say, where is it again? So I guess what I would be asking individuals to do if this appeals to them, if this sounds like it could be something that it could contribute to, is to go onto the platform, and I'll do a bit of a show and tell now. So if you go to hexitime.com, what you'll see is there's a number of hours exchanged this year, so 685, and each one of those hours is contributing to a global target of 1 million acts of kindness, which is the Sunshine people are doing. So that's just something we're collaborating with them to achieve that target. Then there's a number of campaigns. So again, when you're talking about partners, Vanda, if an organizational network want to run a particular campaign to drive energy or exchanges around a particular initiative, a bit like we've done with our Research for All initiative or the Shui Network one, then that allows them a space to be able to do that. And then you've got the kind of list of activities. So this is just one that was posted yesterday by one of my team in Oxford, actually. She's a midwife, but she's also really interested in mindfulness-based approaches. So Claire, if anyone in your team might be interested in that, they could take up her offer. And the way they would do that would be simply to click on it. And you can click on her bio, find out a little bit more about her. You can read the offer. And if this piqued your interest, you can either save it as favorites, that way you can maybe come back to it later, or you can click on take up this offer. She's put up to 8 hours, but she can limit the number of hours that she will be willing to offer. But she's been quite generous there. She's willing to offer 8 hours. And then you can add in a personal message, say, hi, interested in this. So I can't spell interested. And then that goes into her internal messaging system. So she'll get a little notification saying that, you know, Hesham, Claire, or Vanda, whoever has approached them. And then that exchange system happens within the kind of background of Hexitime. So, and you access that via your dashboard. So you'll see within your dashboard, for example, that's just a reminder to check in, is that you'll get a notification. And that notification will say that someone has approached you or is interested in an exchange. So that's, you can also connect people with Hexitime as well. So that's just how the exchange happened. And towards the end of that, once you've done it, then you can credit them one of your credits through that process. And that's kind of the simplest it gets to, really. What you might notice is that all these individuals have 2 credits already, and we do that as a kind of almost a bit of fiscal stimulus, really. So whenever you join the platform, as soon as you've filled in the profile, you get 2 credits to get you started. So you can get before you can give, essentially. So you've essentially got 2 hours just to start you off. And actually, to be fair, you can go into your overdraft as well. So if you go, you can get, in fact, the most we've had is someone going about 30 hours into their overdraft. At that point, I kind of just approached her and said, you might want to give something back. But it was okay. I mean, she was actually gifting some of those credits to her team members, actually. So, but because it's not real money, it doesn't really matter. And actually, in one of the things I've learned, and this is kind of one of the kind of the loveliest things about it, is that the number of offers on here far outweighs the number of requests. So as people are very generous with their time, actually, when you ask them to do it like this. And in fact, sometimes like when people come to me and say, I'm not interested in this Hexitime thing, but I wouldn't know what to offer, I say to them, don't offer anything, don't worry, just take up one of the offers that are on there, or put on a request yourself. Because a bit like on Twitter, Claire, you'll find sometimes if you put a request or a question, you get a lot more responses, don't you, to a comment. So sometimes just fulfilling or putting a need out there, someone will step into that space. And what you're doing there, if you think about it, is giving them the gift of giving. You're giving them the opportunity to be more than they really are, or more than they think they are, to be, fulfill some of their potential. So, again, that might be a question people ask, well, what can I offer? If you don't worry about that, think about what you need. And you have got stuff to offer, just as I mentioned that example from Liv, but there will be others. I mean, this is a nice example here. So Toby, his offer here is on Excel support. So if you're, perplexed by pivot tables, like I am, you could take up his offer, and that's his area of expertise, and that could be particularly useful for individuals who might want to be able to pick up on something that is kind of working within that kind of system. So I just paused for a moment. I wondered if there was anything that I could talk about this for hours, couldn't I, really? But I just want to say what might be useful, or what areas you think might be interesting to focus these last few minutes.
I was just thinking, Hesham, about I just sat thinking, like, what could I offer? Like, what have I got to offer? But then actually, I've got quite extensive experience as a patient. So, and I always think, and I always would like to use that experience and use the things that I've been through and the experiences that I've had from being on the other side. But where can I channel that, and how can I use it to really make an impact. So I do think it's quite powerful, the things that I've been through, and I always think, where can I put that and where can I channel it? And I do a lot of work for Macmillan, and so I do try in snippets, but actually what a powerful way to use a patient story and to use my patient experience to actually improve practice and develop leaders. So actually using my leadership head, but actually offering a patient perspective. So that's what I'm going to do for my homework. I'm going to go away and have a think.
Claire, that would be amazing, amazing. I remember I've only had one experience of a staff member sharing their patient experience, but it gives me goosebumps when I think about it. We were looking at reducing stillbirth rates as part of our kind of maternity collaborative last year. So I put a request out for anyone who might be interested in sharing their patient experience. It was actually one of our paediatric A&E nurses who contributed to that. And I remember her sharing her story of her own stillbirth, how she lost her son in that context. And what was really amazing was how attentively the matron, the clinical leads, listened to her in a way perhaps they wouldn't even have listened to a regular patient, but because she was kind of one of ours, so to speak, because there wasn't that kind of anxiety where, you know, is she going to complain about us, or is there a criticism, you know, coming our way, and there was a real connection and empathy such that a lot of the recommendations or suggestions that she made became part of our processes in Warsaw, actually. In fact, I think she recorded a video about her story to camera to describe what that was like. So I think your suggestion could be really, really amazing.
Yeah, that's my homework. But yeah, but it's nice to be able to, I think that shows the power, I suppose, of what it is that you've developed, that you know, we might all be professionals, but actually what are we beyond our working life, and actually what can we offer beyond that day-to-day, Monday to Friday work, because we are all much more than just our jobs, and I think this really highlights that.
Any other thoughts, Vanda or Tentry?
No, I was just sort of going to write in the chat about the video being available, and it will be part of the box set, which will be available to nationally on the platform. So although you didn't have a huge crowd today, Hesham, hopefully we will reach people. Through the video.
Spread word, you know, I think this
absolutely, which you know I will do for you. So I just wanted to thank you so much for your very interesting talk.
My pleasure, not at all. Thank you for inviting me and hosting me today. I'm grateful for it.
Thank you. I just wanted to finish off before we turn the video off as well with another little quote to finish, which I found from the quote book for the day. So I found one which is quite apt, really. Kindness in words creates confidence. Kindness in thinking creates profoundness. Kindness in giving creates love.
Oh, wow. Very appropriate.
So thank you again, Hesham, and wish you well.
Thank you.
Lovely to meet you, Hesham.
You too.